Hello and welcome to the Tonic Weight Loss Podcast. My name is Harry Hedges and we have a very special guest today. We usually have lots of patients come on here, some of our aftercare team, but lots of patients have been asking for a surgeon and we have delivered for you. We've got the wonderful Mr Adamo. How are we doing, sir? You okay?
Good morning. Oh, very well, thanks. You?
Yes, I'm good, and thank you so much for coming today. We know obviously you're a very busy man in many ways and your time is very much appreciated.
My pleasure being here.
Good stuff. Cool, so first question. What do you find is the key driver why people choose to go for bariatric surgery amongst anything else? Is there a key reason why people maybe think to go down this road?
Yeah, it's a journey. So most people don't go to surgery straight away. No, they tried the usual ways first and they realized that actually it's bigger than them. So it's not something they can do on their own, and then they start looking for support. Some people come to surgery earlier than others. Some people use surgery as a last resort. The bottom line is that people realize that they've been doing dieting for most of their life. The weight has been with them for most of their life. And it's not something related to lifestyle. It's definitely not something that lifestyle can fix. I always says that the weight is not just related to food and to lifestyle. Most of my patients eat less than me and exercise more than me.
Yeah, okay.
So people realize that actually what they're dealing with is actually a disease. The moment they realize that they need a treatment. And that's why they start considering surgery. So, and health becomes the main concern. So it's not just the weight loss, it's the weight affecting their performance, their everyday life, their mood, their confidence. And they decide at some point, that's it, I need to do something about this. I need to look for treatment.
The long-term side of that is so important as well, because this history of yo-yo dieting, well, actually you're one of the best people to ask. When people yo-yo diet and they are a bit all or nothing and they have this dramatic swings, I speak to some patients and they might have lost 5 stone in the past and put it all back on again. What's that doing to your metabolism? Why does that make weight loss so much harder long-term?
So I don't know when at some point someone decided that dieting was a solution or a treatment for the weight, or if you want to use the horrible medical word, obesity. I think that comes down to the misconception that if a person is obese, it's because he eats too much. Okay? Yes, some people can have a weight problem because they eat too much, but most of the time it's a wrong eating habits, eating the wrong time, or sometimes the weight is related to, I don't know, course of steroids or a problem with the thyroid hormones. It has so many factors there. But that one thing is for sure, dieting doesn't work. Dieting is the biggest con. If you look how many diets have been on the market, every year there is a new diet, a new way of administering a diet. What diet does to your body simply puts your body in starvation mode. The body is programmed to keep the weight stable. Regardless if you are 10 stones or 30 stones, that's your weight for your brain. The moment you start losing it by an act of willpower, which is starving yourself, because that's what dieting is, then the body fights back. Body thinks there is no food around you to put you in a efficiency mode, in a saver mode or starvation mode. So every time you start dieting, the body reduces the metabolic rate, increases your hunger, it reduces your sense of fullness, and also increases your production of fat. So you've been driven to eat more, and the moment you start eating, you absorb all the calories and turn them into fat. So that's why it's very difficult to lose weight. It's very easy to gain weight after you lost it. Once you lose the weight, you regain it up and you exceed your starting point. So we call it the weight trap. So you started, let's say, at 80 kilos. If you want to use kilos, you lose 10, you regain 11. And you restart at 81 kilos. What happens is that the second time the body has learned from the first time, so dieting will be harder. And that's your dieting. If you look further down enough, dieting makes you gain weight, not lose weight. And because of dieting, your body becomes more and more trained to function with less. So weight loss will become increasingly more difficult.
I think also like the way we are in this day and age, and this isn't just a generation thing, this has been happening for decades, but people want quick results, don't they? And the idea that you're going to go dramatically low calorie as you say, like it's not what the body wants to do, is it? It's literally designed not to lose weight. And why does bariatric work so efficiently? Because we see patients, lose 3, 4, 5 stone over the course of a year, sometimes more. What's actually, what's the physical thing that's actually happening there?
Yes, so I think that's the key point. So in the old days, and some people think that way, is that you eat too much, that's why you're obese. Surgery will make you eat less, will make your stomach smaller, and that's why you lose the weight. That's not the case. Or it's partially the case. The surgery works in a way more complex way.
Yeah.
So there are lots of ways of describing it. Yes, it's like pressing a reset button and start from scratch. You have to retrain yourself from zero. But the main theory about how surgery works is, think about the body as a complex network where the weight is fixed. So you can't lose weight in the long run because the body fights back. Mm-hmm. So the surgery, what it does is this connected, this wire system, this network, so the system that protects your weight goes offline. That's what surgery does. So you start losing the weight because we just done surgery, the stomach is smaller, you have to relearn how to eat, your portion size is small, but the body doesn't see the weight loss. So that's the key point. Mm-hmm. That's a big difference with any other treatment. And then the body doesn't see the weight loss, you're losing the weight, and the process for the operation that involved the hormone, like the sleeve, the bypass, the process lasts about a year and a half. And then the body slowly rewires itself, and then it locks again the new weight as the weight. That's where the weight becomes stable again. No, of course, a lower weight. And that is usually experienced by people by lots of phenomena like the appetite is coming back.
Yes. I
can eat a little bit more. So I always say surgery acts like a storm to the body, mm-hmm. To the nervous system, to the endocrine system, the hormones of the body. It's a storm. And this storm lasts 1 year. Once the storm is over, the weight is down, and then the treatment has worked. So how does it last forever? It lasts forever for 2 reasons. One is surgery is permanent. So we reshape the stomach, we bypass the stomach, that it does for life. But that is not enough. So with that only, you can regain the weight. So what you need is to relearn how to eat in a different way.
Sure.
And that's where the aftercare comes in. So number 1 is you lose the weight. And that is the best thing you will experience, because with the weight loss comes health. You feel a different person. Confidence, happiness sometimes.
Yeah, absolutely.
Most of the time. I don't sell happiness, but happiness sometimes is linked to that because it's linked to health. So during this time, forget about dieting. You never diet again.
I agree, yeah.
It's about learning a new way of eating. We call it the golden rules. And then if you worked out, you build up your routine, once you lost the weight, what is needed from you is routine. You go your routine, you're eating healthy anyway, but never diet again, never restrict yourself.
The word restriction is, I think, really interesting, because I think people pre-op might think this is a very restrictive process. Of course, there's maybe stomach removed. You can understand where that thought process comes in. But I always say to patients, once that initial loss occurs, it's actually a very progressive process, isn't it? We're asking patients to move more. Yeah, when weight loss has occurred, movement's going to be a lot kinder, a lot nicer to do, particularly things like arthritis and fibromyalgia and these kind of conditions. Movement's going to be a lot easier. So go and explore that. Go and see what it feels like. I think you'll like what you find. Some of I'll be interested to ask about the golden rules you mentioned there, because more protein, maybe more fiber, maybe look at things like your sleep. Can we encourage a sleep pattern, more sleep, fluids, more fluids. This is a progressive message, isn't it? It's quite the opposite to people thinking that, well, I can't do this and I can't do that. That's what diet is. Actually, this is the complete opposite, isn't it?
It's the complete opposite. And then, in a way, at the beginning, surgery works for you. So regardless of what you're doing, at the beginning, you lose the weight.
Because the liquid puree.
Anyway. And that gives an extra confidence, an extra sort of a reason to work on this. And of course, you don't start as an expert. It's a journey. You become an expert, and slowly, that routine it becomes automatic. It becomes the way you live.
Well, I think you just prefer to live that way, don't you? Because
Yes.
you remember what it felt like pre-op. It's a we talk about the non-scale victories quite a lot. It's a wonderful thing to do things with confidence and don't know that you wouldn't have done something before, but go and do something with confidence now. That's a big, big step, isn't it?
Finally, everything starts making sense.
Yeah, yeah.
Okay? Because
yeah.
before, lots of people have experienced that frustration that I work really hard. I work really hard on my diet. I eat very healthily. I count my calories. I do my exercise, and it doesn't work. And now things start working, start making sense. And of course, if you were doing all that before, afterwards, of course you keep exercising because exercise now would be a joy. It's a pleasure.
And it's good for you. Just do it for the right reasons.
Because it's good for you and you're not doing to lose weight.
Correct.
You're doing for the joy of exercising.
Yes, yes.
And with the proteins, of course, we teach a different way of eating. So proteins always first. You always eat the proteins first, the goodies first. One is because when you have smaller portions, you need to eat your proteins.
Because you might not be able to get in later on, yeah.
Exactly. And two is also proteins give you more fullness than carbs.
Correct, yep.
And that is the key. We want to maintain that fullness for longer. So in a nutshell, what we want is to have your 3 meals a day where you decide when to eat, not your body. But by doing that, you feed your body will be satisfied. So all these mechanisms that protects your weight will not kick in. Because the eating is not entirely under our control. So by eating at regular times, you satisfy your body, you're nourished, and that's it.
I think the eating at certain times of the day is actually underspoken about in the industry as well, because it's something that the body has a circadian rhythm, and a lot of people associate circadian rhythm with our sleep. If you go to bed at the same time, you tend to wake up at the same time, and that's a very healthy sleep routine, isn't it? Rather than going to bed late and waking up whenever. A predictable sleep pattern is huge towards our energy, our hormonal side of things. But I think meal timings, and of course, life is life. You're not going to necessarily have the exact time every day, but if you've got an idea and a plan and a structure towards what that looks like, I tend to find on a personal note, but also with lots of patients, it tends to mitigate the snacking. You tend to snack a bit less because you've got that routine towards when the next meal's coming.
Yes, and then there's science and I already know scientifically that if you have a job that involves shifts and night shifts, then your eating is all over the place.
Makes it so much harder, yeah.
And your weight will increase. And we know there are specific professions that are not particularly targeted by the weight gain because of their job pattern. Typical midwives.
Correct. Yes.
Very typical of that. And we all know that if you miss your meal, let's say you don't have the breakfast, and lots of people don't have breakfast, then you end up snacking all day long because you won't get to lunch. And if you miss lunch, again, you will be snacking all day long and you'll have a massive dinner. And that is totally unhealthy.
I think the thing about meals is, if you think about it, it's a very proactive message, isn't it? Whereas if you skip a meal, your day becomes quite reactive, because I think everyone knows watching this, if we're hungry, we become quite reactive, don't we? And not just necessarily in what we eat, but we can be reactive in quite a miserable way sometimes and be quite moody. I think hangry is the word, isn't it? And I always say to patients, of course, we understand that life is busy, work, kids. We're humans. We've got to eat, and I think it's something that should be a message we put forward more to people.
It's extremely important,
yeah.
But also it's important to eat the right food at the right time. There are a lot of mistakes that people do nowadays in good faith, because all the message has been given about healthy food and 5 a day. Some of these messages are not scientifically proven.
Yes,
and it can lead to mistakes. The common mistakes I see in my patients is they have their lunch, they have their dinner, they follow the rules to the letter, but then they need a snack.
The vulnerable evening time, yeah. One of those ones where patients, when you're in that reactive state, it tends to be that junkier chocolate and crisps and that side of thing. And the problem with those ones, you mentioned about protein being very filling. There's no protein in these, and if you think about chocolate and carbs and fats put together, very moreish, very tasty, but not very filling. You can see where there's a problem there, right? And they tend to come in multi-packs. Biscuits. Who has one biscuit? It's nigh on impossible, isn't it?
But that is the an environment where we live, and any food which is ultra processed, is commercially prepared, is designed to want you more, because that's the law of the market. And the Americans a few years ago called this new term of obesogenic.
Okay, yes.
That's the environment where we live, and so we have to be smart enough to make the right choices. But by doing the right choices doesn't mean depriving ourselves of food. So food is a pleasure in life as well, and that's to remain a pleasure after surgery.
I think that's the big message, isn't it? Again, like, this is a progressive message. This is not a diet, as you say. It's not, you can't have this, you can't have that. Yeah, we need to be maybe aware of certain food groups, but let's complement the tool with the right foods. And you just tend to find that, like I said, you just rather do that because you feel more energized, and it becomes a bit of a what's next idea rather than a what's thinking from behind you. And I love the idea that you said about connecting the dots from pre-op, because I think that's a big message, learning, well, okay, that's why that didn't work, but here I am now. Who makes an ideal or a good candidate for someone going down this road?
So I always says to everyone, so what are the key points that makes you successful after surgery, or makes you a good candidate for surgery? So one, you need knowledge, because this surgery they are treatments, so they work only if you understand the way they work. I'm a surgeon. For majority of the surgery, you don't need that. So if I need to remove an appendix, you don't really need much about that. That's the surgery, that's the risks.
And you go away.
You have the surgery, job done. We never see each other again.
Yeah. This is
bariatric
very
surgery
different.
is a journey.
And
then so you need knowledge to start that journey. The more you know, the more pleasant the journey will be. And then you need commitment, because there are dumb behaviors and that changes that you have to commit to. So you need knowledge, you need commitment, and you need motivation. So this is something that it works if you want it to work. It's not an easy fix. It does require your commitment. Saying that, if you put a commitment, if you put the work, it makes sense. Don't get me wrong. When you do a very low calorie diet, it requires way more commitment.
Oh yeah.
And this is totally unhealthy for your body. So you are starving your body. This is different.
And that's really tricky for the industry, isn't it? Because it's one of those, I agree with you, by the way, like, to do a low calorie diet is an extremely hard thing to do. And you speak to certain people who have maybe done that for a period of time, and I think, the willpower you've shown to do that, give me 50% of that, and you'll be able to complement this process pretty well.
Yeah, and then for me, if I see people that have been through weight loss programs, they're not very low calorie diet. The one they are medically proven, medically supervised. So if I manage to lose a good amount of weight on those, I already know the same people will lose huge amount of surgery. The problem with the treatment, weight loss treatments are not surgical, they're not permanent, is that once the treatment stops, the weight comes back.
And you've led me beautifully into my next question. It's like we're in sync. But what is the main reason why maybe someone who's had bariatric surgery might experience regain? Because it can happen. It's usually not to the point of back to square one again. But some patients will report they have put on some weight since then. What can be something that patients can put in practice to avoid that, perhaps?
So I was telling earlier, the surgery works like a storm going through the body.
Yes.
1 year, 1.5 years, depending on the surgery, the storms stops because the body has adapted to the surgery. The body is an amazing machine that adapts to anything. And at that stage, if you maintain a good routine, if you get the right follow-up, the right support, and you do as you've been advised to do, most of the time, then the weight will stay down. If you let your guard down, if you relax, you think, I lost my weight, now I don't have to take my vitamins every day, or I don't have to have 3 meals a day, or fizzy drinks, I'll have a fizzy drink every day, that wouldn't do any harm. Then slowly, the weight will creep in. And then I always say to everyone, the weight gain doesn't happen overnight. It's a process. So the moment you start things are not going the way you are expecting, then ask for help. Don't be ashamed.
That's a big one, yeah.
Don't be ashamed. Ask for help. That's our job. So we are dealing with a disease. The disease can come back. And it's our job to find out what we can do with strategy we can implement to stop the weight gain, number one, and to address the weight gain, number two.
I say that to patients all the time about the whole, there can be, and I understand it when things seemingly aren't going well. I've been to what patients have reported to me that they can feel embarrassed, they sort of bury their head in the sand. And I've even heard patients say to me, I didn't want to disturb you. And I'm like, I'm absolutely, if you haven't noticed this podcast, what we're doing now, I really enjoy doing this. I really enjoy helping people with this stuff. It's a pleasure.
So Dwayne, that takes me to a very important point. For me, it's crucial. There's a lot of stigma around the weight.
Yeah.
So people feel that being overweight or obese is their fault, when it isn't. So when the weight is coming back, they feel ashamed. So they say, oh, I had a sleep, I had a gastric bypass, and despite that, I'm putting my weight back on. Well, it's a disease. Some people are more resistant than others. Mm-hmm. Some people have got protective genes, so the weight loss is very difficult. So we have to remove that stigma, that shame, and I said, we have a problem, we fix the problem. We address the problem, we fix the problem.
And people sometimes get drawn into the comparison of other people's journeys as well, and that can create the illusion that they're not doing very well sometimes. I've had patients who have lost an unbelievable amount of weight in 6 months or a year, but they know one person who maybe lost a bit more, and they think that means that they're not doing well. And that's a problem in not just bariatric surgery, but sort of the weight loss industry. Maybe you could touch on why people lose weight at different rates and things.
Yes. I always say that we have an expected weight loss rate. And that's what I normally check at the beginning, at midterm, at the year. And then sometimes losing too much weight could be something negative, especially if you're not eating. If you're not looking after yourself, of course you're going to lose more weight. Mm-hmm. But that would be at the expense of your muscles, at the expense of your health. You might become malnourished.
Yes.
So for us, what's important is health. Weight loss is a number. So it's a number we could check. We could check blood pressure, I could check blood sugars. And then, so I always say to everyone lose weight at a different rate. And most of it depends on, if everything's right, you're doing everything's right, depends on the genes. So there are studies now done on siblings, done on families having surgeries, on identical twins having surgery. So always says, if you have a family member, like a sibling or a parent that had surgery, that gives you some predictive expectations about what your journey is going to look like, most likely, because you share genes.
Yeah, fair. I think also it's, you mentioned comparing weight loss to blood pressure and heart rate. It's a metric, but it's fascinating how people, again, I'll speak to patients who have lost an unbelievable amount of weight, but they've maybe stayed the same weight for a month. But they don't mention the fact that their resting heart rate's gone down by 25 beats per minute. They don't mention their blood pressure or their type 2 diabetes has been put into remission. It's almost like, of course, everyone knows that medically these are the important metrics, but there's this society thing where we want to feel like we're not. I hear it all the time about the gym. The gym is a classic example. So I don't want to go to the gym because I feel like everyone's looking at me. Now I know that there's always one or two idiots in this world, but most people are just getting on with their day in the gym. They're not looking at anybody else. But there is this very real worry, and I think that's one of the reasons why they don't celebrate it enough, because I suppose there's always this worry it's going to go away eventually.
Yeah, I think the comparison is quite important. Yeah. People compare to each other, and they say, "Oh, this person lost more weight than me." It can be disheartening sometimes. But again, this is a long-term game. Okay, some people lose less at the beginning; they lose more afterwards. If people lose weight the wrong way and faster, sometimes that weight bounces back. So it's very common to see people that go abroad, abroad, they don't have the right support, they lose weight very, very quickly, probably because they can't eat. Maybe there's a problem with the surgery, they can't eat, they don't get the right advice, that weight guaranteed will come back.
Also, that's almost the example of a little knowledge is a very dangerous thing, isn't it? Because if someone goes abroad, they might just think, I just undereat, and you see people celebrate that. I only had 2 bits of soup today. That's not a good thing. And it's a bit, it's like we're in sync again. You've led me perfect to the next question here. Why is aftercare just a non-negotiable?
Because we are giving people a treatment. Some people call it tool, but it's a medical treatment. A medical treatment that does require support. Because we don't have all the answers. Our knowledge increases every day about the complexity around the weight. But the support is important, because without the right support, Doesn't work. I always says, I'm handing you a car. If you don't know how to drive it, you're going nowhere. That's a good analogy. So this surgery, in the short term, yes, works pretty much nearly on everyone in the short term. 3 months, 6 months. You pass the 6 months, you need your support.
And what sort of support would you be looking for a patient to have in the first 12, 24 months? Is there a certain, a dietitian? I mean, is there certain sort of pillars that you would say are non-negotiable?
There's a lot of support. So, of course, it's important for me as a surgeon to check on my patients. Because I can spot problems, I can give advice. After many years, I'm an expert, but I'm not a dietitian. I'm not a psychologist. I'm definitely not an exercise specialist or a trainer. So you see, all of this is essential support. Don't get me wrong. Everyone needs a different level of support.
Yes.
Support is never standard. It's personalized. It's tailored to the needs of that specific person. Sometimes support is having a community of people going through the same journey, so you don't feel alone in that. You don't feel like what you've been going through is just you. There are lots of people. They share the same struggles. They share the same pains, the same problems, the same challenges.
Helps a lot,
and it does help. And when I say that, because most people, when they're looking for surgery or when they're having surgery, most people go online, go to support groups, go to Facebook groups. There are hundreds, thousands of them. The problem is most of them, they are very random.
Okay, it can be very erratic, these groups.
Very erratic, and you can get the wrong advice.
Correct, yeah.
You can speak to people, they have been taught the wrong things. So support is extremely important.
It's we talk about quite a lot at Tonic. I mean, there's meta-analysis studies towards not just people who have lost weight, but managed to keep it off, whether that be through surgery or however it's worked. And the 3 things that come up quite a lot are a form of restriction. So, it can be surgery. Some people might go down a certain method like going low carb or whatever, but there needs to be some sort of, we can't necessarily do it intuitively, unfortunately.
Yeah.
The second thing is a form of accountability. So, and that can be obviously yourself or indeed the aftercare, but a team that are going to check in to see how you're doing, because you're more likely to comply to the golden rule that you mentioned if you've got a check-in incoming. And the third one, I'm delighted you mentioned it, was community. Because it does seem if you're with a group of like-minded people and doing it together, there is this feeling that through maybe asking little questions or going through it together, you are more likely to stick to it. And that's what we've done at Tonic. So obviously the aftercare team, the restriction being the surgery, and the community, we've got the private Facebook group. These podcasts bring the community together. The bariatric ball we have. What we hear from patients after the ball isn't necessarily, I think they like the music and I think they like maybe having a little drink and what have you, but it's actually I'm meeting people who are going through this at the same time as me. That is invaluable.
It's never underestimate the power of the community and to the power of being in a situation where you can ask question answers. I remember going to patient groups, support groups since the beginning, 25 years ago, and it's amazing because people share the experiences.
Yeah. I think also when we're answering questions, even though we're going to answer it with the utmost integrity every single time, we're only human at the end of the day. Yes. I think the patients might go, oh well, he's going to say that. Whereas if you hear it from another patient who's been through it, it can land a bit harder sometimes, can't it?
But regarding the support, it is needed. If you want to look at from a purely medical perspective, and I know mine sounds a little bit harsh, I'm a surgeon.
No, please.
So I was very direct with my patients. We are dealing with a chronic disease. And this has been now certified by all the medical communities in UK, in America. Some of the governments, European governments, including Italy, for example, they have put it down on paper that obesity is a chronic disease. And so we have to use what in medicine we call the chronic disease model. We can't treat, we can't cure. What is the other big disease? We can't treat, but we can't cure. Cancer. Mm-hmm. So think about cancer for 1 second. No, people don't just have surgery for cancer and that's it.
No,
there's lots of support.
Yes.
Or chemotherapy. There's lots of support with that because, for their welfare, for making sure they do well. Similar model.
Yeah, absolutely. Yeah, 100%. And I think it's like we're in sync. We line up the next questions quite nicely here. People are looking at weight loss injections as a an alternative to bariatric surgery, or something that might be, maybe people might consider it worse or better, depending on how you look at it. Are they competing in the same market, would you say?
Well, the reality is at the moment they are, because they've never been there before. So in medicine, it's very rare to have important drugs being released at some point. And for me, as a doctor, it's amazing we have drugs now. They are being designed based on what surgery does. So the scientists look at all the changes in surgery does. They're trying to replicate it with the drug, and they manage to replicate one of the aspects of surgery does, which is the GLP-1 hormone. These hormones are quite old in the body. They are quite at the base. They are shared with animals. So it's difficult to tweak them and to use them for our purpose, because you want one effect, but you can cause other hundreds of effects. So these drugs are very good. They're amazing treatment. And they are allied to us. So now we start talking about combined treatment. So some people start on the medications, then the medication can take them up to a certain point, and then they move to surgery, or vice versa. Some people have the surgery, maybe less aggressive type of surgery, which are easier to maintain in the long term, and then they use the medications afterwards. So for me, the fact I've got the medications available is a blessing, because it's an extra level of support I can offer to my patients. But definitely they do not replace surgery or an alternative to surgery. The big problem with the medications are they only work if you take them.
This is going to be my next question, yeah.
This has been scientifically proven now. We've been knowing it for a long time, but now we've done trials on this. So first of all, 20% of people don't respond to the medications. So you take the medications and they don't work on you. There's nothing wrong with you. It's just the medication doesn't work on you. It's not that you're not following the rules. It just simply doesn't work. Or other people have side effects. So now we have changed the way they use the medications, because we're learning. They're new. We're learning. So if you have significant side effects like nausea, tiredness, abdominal cramps, vomiting, you must stop. So these medications are quite powerful. They have to be used only under strict medical supervision. You can just buy them off the internet. It's not paracetamol.
And this is a big worry.
Paracetamol can kill you in the wrong dose. Yeah. These drugs can as well. So the moment you stop the drug, weight comes back. Eventually, slowly, quickly, depends on your lifestyle, depends on your genes, but the weight will come back. And the second problem with the drugs is they're deadly expensive. So now they calculate that either you pay for it or the healthcare pays for it. They're not sustainable in the long term.
You mentioned getting hold of it on the internet and that sort of private side of it, and I touched on earlier on about the accountability, the importance of the aftercare. How concerned is it that people can just buy this stuff privately without any real understanding of how to use it, and what could be the potential hazards long term on something like that?
It's a terrible problem, because of course we can stop people buying. I think people do that because there is a lack of education from our side. Now, from our side, so these drugs are there. No, we can stop the black market. We can stop people buying it. But drugs are drugs, and they can cause problems. They can cause significant side effects. They can kill people if taken the wrong way. So don't underestimate the power of the drugs. So they have to be used within safe limits. And then the government will have to start making changes to make sure that when people buy the drug from professionals, so then at least there are certain checks being done.
Yeah. I think that there seems to be a comparison piece in the weight loss injection market of, well, being obese is an unhealthy thing and can cause a problem long term. I'd rather do this. And it's like, I don't think that's actually the battle here. There is a middle ground, isn't there? And I think a question actually I'm really keen to ask you around is, I think some people are starting to justify that, so there's an aggressive increase after we come off them. So there's this blurriness around, I'll just take them the rest of my life, which I'm exceptionally uncomfortable with, because I just think, well, then you're handing over control to maybe price changes or availability of these drugs. But also, we're talking about bariatric surgery in a way of, you have this done and there's this shock factor, And the idea is that we build progressive habits for the rest of your life going forward. That to me is an empowering journey. The weight loss injection, I'm just going to take this for the rest of my life because I'm terrified of regain, doesn't seem to sit in the same place. Does that make sense?
Yeah, I mean, I get asked a lot of times, so what's the effects of the drugs in the long term? And the answer is, we don't know.
I was going to say, it's not there, is it? We don't, people compare it to diabetics, but it's very different, isn't it?
But even that, I mean, the drugs, either for diabetes or weight loss, have not been there for more than 5 years. Mm-hmm. And there's been such a change. So the drugs that came out at the beginning, no one even sells them because nobody wants them. Mm-hmm. The drugs, we don't have long-term results. On the other hand, for surgery, we have 20, 30 years worth of data that tells us the benefit of surgery in the long term. And you could say, well, the drugs, they must be safe because they're being released. Yes, the drugs are safe as far as we can tell. There have been previous drugs released for weight loss. They had to be stopped because of severe side effects. So the drugs that went into the market passed what we call the trial phase, and then they had to be retrieved from the market because of unexpected side effects.
Right.
For example, sibutramine. Other drugs were affecting people's behaviors.
Psychologically?
Psychologically.
Yeah.
Suicides.
Wow.
Suicide ideation, suicide attempts, increased risk of suicide. So drugs are there. There will be new drug coming up. There is a new drug coming out, the ribitotide. There is a huge noise about the ribitotide, and people taking it. I say, wait a minute, this drug has not been licensed yet, not in UK, in the world, because it hasn't completed the trial phase.
So people are preempting drugs that aren't out yet, even though it's not even been fully licensed. It's scary.
So it is irresponsible. No, it's the same as taking a class A drug. No, these drugs are not being licensed yet. So what are you doing?
It screams of that. Weight loss is a very emotional game, and I think the idea of bariatric surgery is that we know it's emotional, we know it's psychological, we know there's all these factors towards it, but again, the message is clear. What can we do more of over time? I think that the understanding of the injections is there's still this celebration that I'm not eating very much, and there's not that kind of, it's a celebration of restriction rather than, I mean, we mentioned the GLP-1 hormone, what's biologically happening when people are taking these? So just people talk about food noise quite a lot. Is it literally just the fact that food noise, so we consume less, or is there a metabolic change there at all? Or
But there's still lots of things we don't know.
Yeah, okay.
So the GLP-1 is the hormone of fullness. So by taking an external GLP-1, which is actually not a GLP-1, it's a drug that stimulates the internal GLP-1, we send a false signal to the brain. So the brain thinks you're full, and that reduces the food noise. If you have a gastrectomy, if you have a gastric bypass, your GLP-1 goes up naturally. So that's why the drug companies have researched a pharmacological way of increasing the GLP-1.
Replicating that, yeah.
And then they are claiming that because we do it with surgery, then it's probably safe to do it with the drugs in the long term. The way it happens with surgery, though, it is different. It's an endogenous way, and usually the levels are higher. So surgery is more effective.
And I think we all know somebody who's gone down the injection road. We know that weight loss can slow down the lighter you get. Metabolically, again, the body does that. We mentioned even the shock factor after bariatric surgery. There is an element where after a period of time, we've got to go more down the lifestyle approach. The people I know who've taken these injections maybe have lost weight. Does the body get used to them? Because it seems that people find ways around. I've had patients, not obviously bariatric patients, but people I know reporting that they're starting to snack more, the food noise is back. Is that something that happens over time?
I've asked that question to myself as well. Because most people do with the drugs, they do cycles. So they do a 1 month, 2 months, 3 months, 6 month cycle, they lose the weight, and then the weight start coming back and they do another cycle.
Might go holiday or Christmas or something.
Yes.
Yeah.
So cooling off and restart. So there's a whole culture around that. So I look at my practice. I ask also my colleagues. So it seems to be not for everyone. For majority of people, the body gets used to the drug. So the second time round is not as good as the first time.
I've heard that as well. Yeah.
So, and that's why lots of people have been moving from the liraglutide
to
the semaglutide. then now they move to the tirzepatide, and then they probably move to the ribepatide when it will become available, because the body gets used to the drug. So it's not that okay, this drug is working, now it's fine, and then I'll take it forever, and then it will be fine. No, probably that the body will react, and eventually you have to swap, or you have to increase the dosage.
And there's an uncomfortable nature to me of this cycling of drugs.
Normal that people are very excited about it.
Yeah, of course.
Injections, because they are new. So it is normal.
I think it is normalised as well, isn't it?
Normalised.
Yeah.
In a way, it is making people accepting more and more and more that we deal with a disease. We need treatment.
Yeah, true.
And the moment people start understanding that you need a treatment, then they start evaluating all the different treatments available. And they realize that surgery, one, is the most effective and in the short term and in the long term, and two, is the most cost effective. If you look at a 3, 4, 5 year span.
Well, it's a vicious cycle, isn't it? You've got this drug that, if you come off it, serious weight gain occurs. It slows down over time. You're paying monthly, and people again are only human, right? If something slows down and doesn't feel like it's working anymore, they're probably going to. It's desirable to stop making the payments, isn't it? So it can create quite a vicious cycle, I think, sometimes.
It is, people act out of desperation.
But the short-term wins, you hear a lot about it.
Short-term win is amazing, but you can get short-term wins with a low-calorie diet as well.
Yeah, very true.
If you think about how much money people have wasted in X diet, Y diet,
Oh wow!
and then they do it again, and they do another one, and then of course now they're moving to injection. The thought of surgery, understand, it can be challenging.
It can put people. Yeah, I agree. Yeah.
So, but you have to look at it from a more objective perspective. Is a disease which will damage your body, will shorten your life. So, it's important to take that into account when considering all the different treatments.
Fantastic. Well, great conversation. I was engrossed there. I said to you about 20, 25 minutes. I think we've gone about an hour. So there we go.
Well, I love my job.
Yeah, I can tell. It very much comes. And one question I think is quite a nice question to ask any sort of surgeon. Obviously, you had the pleasure of helping so many patients in the past. Have you got like a favourite doesn't have to be specific to a person, but a favourite non-scale victory that you see patients achieved after having surgery? Is it something that you see where maybe, I don't know, people celebrate dress size and stuff, but my one, for example, is when people start a family. I think, wow, what an amazing achievement to something that wasn't available before. Have you got like a favourite that you heard?
I've got so many stories, and I love my job. First of all, I love when the woman approaches surgery because they are struggling to conceive.
Yes,
they have the surgery, and then not only they lose the weight, not only they have got their life back, not only they become healthy, but also they are successful in conceiving and building up and having a family. For me, this is priceless. Every time it happens, it gives me so much joy. And then, of course, there go people that they've never done exercise in their life. They have the surgery. After they run and complete the London Marathon.
We've had marathon runners at Tonic. Yeah, incredible.
One of my patients, 8 months after his leg gastrectomy, climbed the Everest.
Oh, wow.
With a team, and successfully came back alive.
Wow. It just creates such a, like I said earlier on, it creates such a, what can I do? If you mentioned earlier on about the willpower to lose weight in the past, and people have done that. I think that's one of the hardest things you can do. So once you've kind of put it, I always explain to patients that a successful weight loss journey is that it's no longer about weight anymore. You're too busy doing other things,
yes.
And of course, in an exercise, I'm biased, but I think that does really live in exercise. You mentioned earlier on about the body being extremely adaptive. And one other thing about exercise is it's predictable. If you lift weights, you become a stronger person. Yes. If you do cardio, your heart health literally will get better. Isn't that a nicer metric to go by rather than the volatility that weight provides?
Yes, and then so it's not just the weight; it's the body composition. That's always
mobility.
Yeah. Always tell my patients, always look at your weight loss journey. Your first year is your weight loss year, where you lose the weight, you learn how to use your surgery. Your second year is your reshaping year.
Yeah, nice.
Where your weight might go down a little bit more or may gain a little bit, but what happens is your body responds to your changes, to your increased activity, to your sport, so you build up muscles, and muscles are heavy. in the body.
Yeah, yeah, absolutely. Yeah, I spoke to a patient yesterday, and she was, I think, just coming up to 2 years post procedure, lost over 10 stone, under 140 pounds, and she wanted to lose about another stone. In her head, that was where she wanted to be. But she said to me, "I'm very happy to lose 14 pounds in 2026. I'm so busy doing my exercise. I'm so busy. I understand I'm putting on muscle mass. If I can lose 14 pounds this year, that'll be." And I said to her, I was like, with that mentality you've got, you know, we might have to make a couple of tweaks here and there, but you're in a tremendous position. 10 stone down with an open mind to a year to lose another 14 pounds.
That's amazing.
That's the perfect mindset, isn't it? It's not about the weight anymore. It's about everything else, and the weight loss is probably this byproduct.
Weight loss is
Yeah,
a number.
yeah.
And I always says to everyone, so it's important the weight loss. Yes, everyone has got a goal weight, but also the system is misleading us with this BMI, which doesn't tell the whole story.
I'm glad you said this, because I'm a bit funny about BMI as well.
So we had several meetings internationally, both the surgeons and the physicians. So now we came with a new concept. So after treatment, that treatment includes all the treatments available, and especially surgery, from a medical perspective, the objective is to reach a BMI of 27. Which, if you don't have surgery, if you look at the BMI scale, it means overweight. But from a medical perspective, the treatment, the objective is reaching a BMI 27. That's our goal weight. Well, you might be way lower than that, but from my perspective, no. The moment a patient is 27, I'm fully satisfied.
And you mentioned muscle being heavier. That is an aspect, isn't it? I've been lifting weights for 10 years. I'm heavier because I've been lifting weights for 10 years. It's not a bad thing. And I think BMI is one of those things where it's obviously quite old as well, isn't it? It's a couple of 100 years old. It tells a story, but I suppose the main message we're sort of saying here about weight loss is it's not the only story. There's other things you've got to go by. A BMI of 27, I'd rather have a BMI of 27 and climb Kilimanjaro or Everest than be a 25 and not doing that. And I think that's kind of the message, isn't it? Yeah. Perfect. Mr. Adamo, thank you so much. Thank you for joining us today.
Absolutely my pleasure. All the best.
Guys, what a fantastic podcast. Just having the surgeon side of things is always so welcome. The knowledge, clearly the passion, and just thank you for tuning in, and we will look forward to catching up with you very, very soon. Goodbye.
Goodbye.